Hello viewers, today in this video I am going to talk about eye-brain coordination as well as its relevance to the cognitive function. See, cognitive function is one of the important functions of the brain which helps in assimilating, spreading, memorizing and acting on the impulses that is there. So it is a very comprehensive network which involves a visual system. See, whenever we see, the light passes through this eye and goes through this retina, and then it will convert into electrical impulses and pass through this optic nerve and then goes to the back of the brain, that is the occipital cortex. So the signals are in an inverted fashion. The brain makes it straight, and then further the brain spreads to this images to different parts of the brain to coordinate. So like the movements and the memorizing part and all the different parts of the brain functions these things, and the occipital cortex, the main part of the visual cortex, sends the signals to these concerned brain areas. Then finally these things will act as in a coherent manner to help the person to behave in a manner which is suitable for him, like walking, talking, interacting and all those things. So whenever there is problem in this visual pathways, then the brain won't get a proper signal, especially in children, like when they are in this small age, like 2 to 6 years of age and all, the brain is still developing, and if they don't get a proper visual stimulus, the brain development will not be good. So they will develop a lazy eye. See, many times they have refractive errors, they have number and which is not corrected, they have a very poor signals to the brain. Secondly, they usually have squint or strabismus, where a crossed eye, where the eyes will not be aligned and the signal one eye will go but the other eye will not go. So the one eye will dominate over the other eye and the signals will not be proper to the brain. The development will not be there. What is known as a 3D or the stereoptic vision will not be there in those children. So we should have both eyes aligned, both eyes have a proper signal to the brain to have a very good image perception and further translate into all the other parts of the brain and the cognitive functions. See, that is one for in children. Then if you don't correct them during those supple age of about 7 to 10 years, then they have usually a very long-term consequences in children. So you should not allow them to land up in those lazy eyes. So you should have them checked regularly, update their number and update their do patching or other. We usually do vision exercises to stimulate the nerves and then improve the vision. That is one part. Second part is that in children, cognitive functions, if it is affected, they will lose attention in their activities, sporting activities, be it learning, academic skills gets affected. So overall development of the child gets retarded because of the poor cognitive function which is linked to the vision. So it's very important to have a good vision, good proper checkup and a very good cognitive function. Now the same thing applies to the elderly also, middle age and elderlies. In elderlies also people develop a lot of eyes related problems. The eyesight drops down. In the middle ages we have the presbyopic or the reading glasses, and in the old age the people develop cataracts, they develop macular degenerations, age-related macular degenerations, then they have this glaucoma kind of diseases which affects the nerve as well as the signals going to the brain. So once these things happen, their old age they have cognitive impairment, their activities, their interaction with the public, interaction and overall holistic development of the old age people also get affected, and that is very important to get those things corrected. So to have the vision back to the normalcy so that the cognitive functions develops and they will respond properly to the external environment stimulus and they interact with the other colleagues and friends. That is very important. And so to have a very good cognitive function, we need a very good eye which has got a good eyesight, that is a proper vision. Vision can be corrected only when you go and check your eyes, and according to the age group different diseases are there, different modalities are there for treating them, and once you treat them in time you can have a very good eyesight as well as a very good brain signal which is translating into a very good cognitive function, and you can have a very healthy, happy life. Thank you.